Hello, thank you for joining us for the 23rd Annual Virtual Elder Abuse Conference, Serving Older Adults During Times of Isolation. This conference is presented by the Syracuse Area Domestic and Sexual Violence Coalition's Elder Justice Committee. My name is Lori DiCaprio-Lee, and I am the ID Theft and Outreach Coordinator at Vera House. Before we begin today's presentation, I'd like to acknowledge some recent events. The COVID-19 pandemic has highlighted issues of inequality. Older adults, those who live in poverty, and members of Black and Brown communities have been more severely impacted. The Elder Justice Committee values all older adults and stands in solidarity with the Black community. We pledge to uplift the voices of Black people in our community and to strive to fight the injustices that have led us to this moment. Thank you. So moving on to other announcements. All webinars offered during this conference are free, thanks to the generous support of our sponsors. And I want to particularly recognize our platinum sponsors, Loretto and the Onondaga County Department of Adult and Long-Term Care Services, our gold sponsors, Syracuse Jewish Family Service and Wegmans, and our silver sponsors, the Alzheimer's Association of CNY, At Home Independent Living, Community Bank, Countryside Federal Credit Union, Crouse Health, Fulton Savings Bank, the Syracuse University School of Social Work, and Touching Hearts at Home. More information about all of our sponsors can be found on the Vera House website. The support of these sponsors not only funds this webinar series, but also extends beyond the conference to continue elder abuse education and prevention outreach after the event. And one last announcement before we begin the webinar. The chat feature has been disabled. However, you can ask questions using the Q&A, which I will be monitoring. So today's webinar is VA Social Workers Serving Elderly Veterans During a Time of Crisis. And our presenter is Michael Close, a social worker at the Syracuse Veterans Affairs Medical Center. And so with that, Michael, I turn it over to you.
Oh, thank you. I appreciate it. Welcome, everyone.
I'm going to share your PowerPoint.
Thanks. So welcome, everyone, to today's presentation on the Syracuse VA and how the social work staff here at the VA can help assist elderly veterans specifically during a pandemic, but to be more specific, just all our veteran population. And I just want to also make a note that this is a very social work perspective. You know, this is a perspective very honed in on the social work model, working within the hospital. All of the services that I'm going to talk about today are services that exist whether there's a pandemic or not. The delivery of the services are all that changed. So today we will talk about what the hospital and what the Syracuse VA and all the services look like during this time, you know, the last 3 months of the pandemic, and the services that we are able to provide when there's a pandemic or not, just regular services. Next slide, please.
Hang on for 1 second, it's not moving. Let's try this again.
Okay. And that's why it knew what was coming. So I apologize for this giant picture. Just a little intro about myself. I've been here at the Syracuse VA for about 5 years. Currently, I work in the nursing home, and the VA calls that the Community Living Center. There's 2 social workers on our floor, Michelle Smith and I. I've been here at the VA for about 5 years, both inpatient, primary care, and currently the nursing home. Before that, I worked at hospice and St. Joe's Oswego Health Home Care. And before that, I was in the Air Force for 11 years. So that all equals 16 years of total federal service. Next slide, please. Some fun facts about, or at least fun facts to me, regarding the VA. All over the nation, the VA serves about 9 million veterans across the U.S. The Syracuse VA specifically consists of the main hospital downtown next to SUNY, across from Falk at SU. We have our mental health clinic down on Erie Boulevard. We have 7 satellite offices across our region. Our region of the Syracuse VA spans from the St. Lawrence River all the way down into Pennsylvania, and then as far east and as far west as basically as people would like to travel. We serve approximately 13 counties across central New York. We have 50,000 plus veterans enrolled in our healthcare system just here in Syracuse. And then this is my public service announcement, this last bullet here. So the VA is the country's largest healthcare network. It is not health insurance. So the VA doesn't necessarily cover if you wanted to just go anywhere, unless the VA didn't provide that service. If the VA sends you somewhere, they would cover it. And then the Syracuse VA was, the last I knew, the Syracuse VA was the 2nd rated hospital in all the country. So it was the 2nd best VA in the United States. I always tell veterans that when they, when they're talking about the Syracuse VA and how good their care is. Next slide, please. So what can you expect from the VA during a pandemic? So we're real focused on what's going on today everywhere across the country, but we're focused here in Syracuse like anywhere else. But the one thing that I wanted to remind everybody is there are always situations where we have to close or make our services much more directable. And just a couple reminders, a few years ago, Puerto Rico had the hurricane. I believe it was Maria, but I'm not sure, where the island was torn up. Several VA employees went there and helped the VA restructure itself while the employees of the Puerto Rico VA were taking care of their family. And then to really bring it home, we all know what the weather's like in Syracuse in the wintertime. There's, at any point, the VA might have to close for 3 or 4 days for a snowstorm or ice, or for whatever reason where the roads just couldn't get clear. Some of these are just other examples that I would want you to think about, except for not just the pandemic, but there's other things out there. Next slide, please. So the goal of the VA is to continue to provide quality care like any other day. When the pandemic started and we shut the doors here, basically, from people just coming in day to day, our goal of providing top quality healthcare did not change. We just basically changed the front door. The services that we provide, the healthcare that we provide, all the specialty clinics, everything stayed the same. things just looked a little differently. For example, I would have to say we probably have 5 or 6 doorways where anybody could just walk into the hospital here at the VA. We closed all of those and kind of funneled all of anyone coming in, employees, vendors, patients, everybody kind of came in through the same door, and their temperature was taken, they were asked several questions, and they had to have an appointment. And able to come into the hospital, you had to have an appointment. People were not just allowed to come in and visit, they weren't allowed to come in and pick up their prescriptions. The front door had a runner, and if you needed a prescription, they would run your information to the pharmacy and come back with the script. So we didn't let folks just come in and kind of hang out. There was a real neat drive-up service. So we didn't want people to not have their hearing aids or glasses working the way they were supposed to. So you could drive up, drop off your hearing aids, for example. If it needed just a quick fix, the audiology department would fix them, return it to the veteran, and off they go. Or if they needed to order parts or something like that, they would make arrangements. A couple of things that just started within the last 2 weeks was a drive-up immunization clinic and COVID screening. We'll talk about this a little bit more later, but as we start to reopen the VA, we are starting to have procedures again, same-day surgeries, things like that. Some people may have to get an immunization or blood work and a COVID screening before the procedure. So they don't come into the clinic. We would go out to them, take care of all that, and then they would come back whenever their procedure was planned. A couple other things that you notice as you're walking around the VA over the last few months are, the hallways are clear. There are usually walking around here, you're pretty much talking to somebody every few steps. You're saying hi or good morning or are you lost? Can I help you find something? Right now, you could walk a whole hallway and not see anybody walking around. I had mentioned before that I work in a nursing home. The nursing home hasn't had any visitors in months. So unfortunately, the veterans who live here in the nursing home, in order to help COVID stay out of our facility, we haven't been able to have any visitors come up. Next slide, please. Oh, and I would say probably the biggest part, what it looks like differently, is everybody's walking around with masks on now. So initially, when the hospital had decided to close everything, initially all non-urgent clinic appointments were canceled. So all the primary care appointments, people were not coming in for those. Anything that wasn't emergent, life-saving treatments were canceled. It took a few days for our routine appointments to get changed to telehealth appointments, which happened, pretty quickly within a few days. And then it took a little bit longer to get the secure video chat set up. Here at the VA, we have a whole department that's called telehealth. And what we are able to do is to get iPads issued to certain veterans if they meet, certain criteria. And then they can see their providers right over an iPad. And I think we'll talk about that a little bit more, but what we call that is virtual video conferences, VVC. So back to a couple of the changes. All surgeries were canceled, all non-emergent surgeries. So the only surgeries that were happening were the emergency ones out of the ED or out of inpatient. All of your non-emergent, carpal tunnel, things like that were canceled. No visitors were allowed in the hospital. I mentioned that before. The few exceptions were if a veteran was imminent, we would make an exception if someone was imminent and we wanted their family to come in and see them quickly. And then there were still precautions taken. All of the mental health groups and individual therapies were canceled. They were all, again, very quickly changed to virtual care. Initially telehealth, and then maybe a week or so after that into the VVC, the virtual video conferences. And the group therapy works real well with Zoom or the VVC. Next slide, please. A couple things that have not changed or never changed. They didn't change right from day one, and they still haven't changed today. The emergency room, what we call the emergency department, is remained exactly the same. No one has been turned away from the ED. If someone didn't feel well, they came in there, they were triaged and either sent home or admitted just like any other day. There was increased social work interaction there with the increased triage to reduce hospital admissions. So if someone was coming in just with caregiver issues, social work would be more involved on the front end of something like that. The acute hospital was running exactly the same. The focus there remained on healthcare, just like it does any other day. We work daily on timely and safe discharges. So either to home or to rehab or to any other facility if needed. One thing the VA was able to do was we added 15 additional beds to prepare before we knew what Onondaga County was going to look like with COVID. The governor and the mayor, so everyone was asking Syracuse to kind of be ready in case we had a huge influx of COVID. So we were able to quickly, within I think a week, develop 15 isolation beds just in case we needed it for a surge. So if upstate needed space, we would be able to help, or if the VA here needed help, or if the VA downstate needed to move people around. The Syracuse VA was ready to step up and help them out. Another part of the Syracuse VA that played a huge role in this, probably a little underscored, would be housekeeping. Housekeeping played a huge role in bed turnover and cleaning the facility daily. You saw more housekeepers just cleaning things than you'd ever would have seen. You saw them in the parking garage, you saw them outside, you saw them in the rooms turning beds over. I'm sure they worked some serious overtime there. And I'm sure at the end of all this, the hospital administration will probably give a shout out to housekeepers, because they're generally kind of underappreciated anyway. Next slide, please. Some things that we noticed here. There was a much larger utilization of phone calls and telehealth appointments. That's going to be a kind of a common theme throughout this presentation, as all of those non-urgent appointments that we were talking about earlier, as those are being rescheduled, there was a lot more phone calls happening. The telehealth appointments, although great, sometimes with that VVC, you still need bandwidth. And if you have 1,000 people trying to sign on to the internet at the same time, something's going to give. And I think there was actually some news stories about all the employees and students trying to sign on to the internet first thing in the morning. Well, the VA was the exact same with that. We had talked a little bit earlier about the reliance with the community partners for disaster prep, and how the VA was a backup to several other local hospitals and other organizations. Eventually, support groups all switched to online, either Zoom or the virtual video conferences, which was great because 4, 6, 8 people could all sign into a virtual video conference, much like we're doing today, and all the microphones would be open, and they could have a support group like they would anywhere else. And again, remember, the VA does have the ability to get people iPads on a regular basis. I'm not aware of how COVID had affected that. When you have hundreds of people requesting an iPad on one day, I'm sure weren't sitting there with iPads for everyone. But people who already had them could roll right over to video conferences. Probably one of the bigger things that you noticed walking around the VA was a lot of the employees weren't here. Most of the business kind of function of the VA worked from home, and compressed work schedules were also very, very effective. For example, myself, I was moved from 5/8s to 4/10s, effectively just getting me out of the environment for one extra day a week, which is not bad. A 3-day weekend every weekend for the summer so far has worked out okay. Next slide, please. So we're going to get a little more focused in on social work right here. I guess this might be a good place to stop and check in with Lori. No questions on kind of the general VA stuff yet, Lori? I'll take that as a
Sorry,
no.
no questions. Yeah, I was
Okay, that's okay.
for me to unmute myself. Sorry, no questions so far.
Thanks. So just a reminder that, this is a focus of social work and how social work specifically fits into the treatment of veterans. The VA is the largest employer of social workers across the country. There's approximately 15,000 social workers employed by the VA. The VA is the largest placement opportunity for MSW students, approximately 1,100 interns across the country. That's a lot of hours and a lot of students that come through the VA, and across other fields too. The VA is known for being that kind of teaching environment. There's a ton of opportunities within the leadership roles across the VA for social work. In the central New York State, New Jersey region of where the Syracuse VA fits in, there's several VAs. Buffalo all the way to Long Island. There's, I think, 2 or 3 of the medical center directors are former social workers. I think that's kind of neat. And then just this morning, I read an article on a former social work executive from Syracuse who is a legislative aide to a congressperson in California. And that person started as a social worker at the Syracuse VA. I thought that was also pretty neat. We have one care line manager. No, I was right, 2. We have 2 care line managers here in Syracuse that are social workers. The first care line manager of mental health is usually an MD or a psychologist. The one that we have right now, Lauren Love, she's a social worker. And then my care line manager is a social worker in medicine. So that's a social worker who runs the whole department with all the doctors, all the physical therapists, all the occupational therapists, the whole system. And she reports directly to the chief of staff. So it's pretty neat that social work plays such a big role in the leadership of the VA here in Syracuse. Next slide, please. So outpatient medical outreach. Well, this is probably being one of the biggest players in the COVID environment. I'm just going to wait for the slide for a sec.
Sorry, I don't know what's happening again. Hang on.
That's okay. That's all right. So within the outreach for the outpatient medicine, you have primary care. Primary care probably being one of the bigger pieces of healthcare at the VA. We have 4 clinics being in their, all, like I said, all outpatient. There we go. Thanks, Lori. Each clinic has 3 doctors, 1 PA, 1 NP, 5 nurses, well, 5 RNs, 3 LPNs. They have a pharmacist, a dietitian, social worker, psychology. It's supposed to be its own team within the system that provides all care outside of specialty care for the veteran who comes in. That would probably be where the majority of your outreach happens from the medical perspective. That's the first stop where people come with questions. They're the first ones to call veterans at home. They would have been the first group of social workers to call people when this COVID thing started. They would also be integral in putting together alternatives. So how are we going to get your care to you? How are we going to get prescriptions to you? You know, what can we do to make this transition? Because at the time, and still, we really don't know how long this is going to happen. They would be the group that would really start with that, the big portion of outreach. And to give you a clue of how big a primary care team is, each panel is what we call it. A primary care team that I named is 1 doctor, 1 mid-level, 1 nurse. That it's about 4,000. So each team has approximately 4,000 people. And if there's 3 doctors, oh, I'm doing my math wrong. I'm sorry. So each whole team has about 4,000 people. So each doctor would have approximately 1,000 or so. But the social worker, in theory, would be responsible for about 4,000 patients. Now, granted, not every one of those patients are active, not only with the VA, but they may not be active with primary care. So it's not as if every single person is getting called. A couple other programs that we have at the VA: intimate partner violence. If one of the providers in primary care or in acute medicine or literally any other clinic in the hospital identifies someone as being a potential intimate partner violence person, they can do a referral to this social worker named Aaron Scott, who would reach out to a person and try to come up with a plan if they needed or wanted assistance. We have a department called caregiver support. And what they do is they help folks who are the caregivers. So if there's a veteran who's home who has their spouse is taking care of them, the caregiver support team would provide support to the caregiver. And there's supposed to be an extra bullet in there. See where between caregiver support and transitional case management. Transitional case management's another bullet. That is for the younger generation veterans. So the folks that are getting out now that are post 9/11, post Desert Storm era, that transitional case management helps somebody transition from the military into the VA system. And that's a whole nother area that does outreach. We also have a home-based primary care, which is very similar to home care in the community. So like a CHA, like a St. Joe's Home Care or a VNA. We also have women's health. Women's health provides primary care and case management to the female population at the VA.
Before I move on to the next slide for you, we had a question about the Intimate Partner Violence Program. Is there any specific resource for elder abuse?
Not currently. Not currently. So in the next slide, you're going to see where you have, well, not the next one. In a couple slides here, you're going to see where we have our inpatient social workers, and then in the outpatient outreach, we have the primary care teams. So the quick answer is no, we don't. But each part in each one of these programs who have social work involved, that is part of the assessment. But there's not a specific team just to address elder abuse. That would, if that would probably come under my role as being the representative on our team. Does that answer that question? All right, so we have a regional center of care in Syracuse, and that is the spinal cord injury floor. We have a floor that's dedicated just to spinal cord injuries, and it's a regional center. So all the other VAs in our area, people would come to the Syracuse VA for care if needed. Within that floor, we have an acute rehab, and we also have the ALS clinic. In Syracuse, only upstate and the VA have acute rehabs. We're the only two, I believe that's still true, that we're the only two that have acute rehab. And then the interesting thing about the spinal cord injury unit is that unlike traditional care where a person would go to the provider only when needed, once a year, a veteran that's enrolled in that program, and the SCI program is what we call it, spinal cord injury, they come in once a year overnight for basically a head to toe assessment. Every discipline on the team does their assessment, and the individual is worked up top to bottom. And they try to develop a treatment plan on those issues that are brought up during that assessment. Next slide, please. The Community Living Center. This is where I had mentioned earlier is where I'm currently working. The Community Living Center is what the VA calls the nursing home. We not only do we take referrals from within the VA, but we also take referrals from the community. So I would get a request from, say, SUNY or any other hospital in our region if someone wanted to come to the nursing home for long-term care, for short-term rehab. If they had IV antibiotics for 6 weeks and they couldn't manage that at home, they could come there and get it there for a short time. We're a 43-bed unit. We also have a small respite program, and we also have a hospice program too. Lori, any questions?
So not a question, but a comment to
Okay.
expand a little bit on the first question, and I'll read it. It says, "Hi, it's Erin Scott, the intimate partner violence coordinator at the VA. We do not necessarily have anything specific for elder abuse right now, but we are coordinating with the caregiver support team in order to develop additional services. We currently provide safety planning and offer a strength at home group for veterans who are at risk of using aggression. This is not age specific, and we would welcome elders if appropriate." So just a little bit of clarification.
Thanks, Erin.
Thanks, Erin. I'm going to mute myself again.
All right. So the CLC, I had talked a minute there about the general program. Under the COVID environment currently, we are taking no referrals from the community. Our respite program has essentially shut down, unfortunately. And hospice patients we're only taking from the VA. So they have to be downstairs in our hospital. They have to have a COVID test within 24 hours of admission, and they have to be in the hospital for 14 days before they're admitted to the CLC. So the change in the COVID environment has been that we're not so quick to be able to help folks coming out of the hospital. We just had to slow it down a bit and get more testing before we were able to offer space, because again, we do have 40 veterans up here that we have to take care of. We have to protect everyone on the floor. Oh, next slide.
Sorry, it's doing that thing where
That's okay.
freezing on me.
So Lori was, before we started, giving me a hard time about this next slide coming up. This was supposed to be like an interactive letter jumble that I think probably the majority of folks on the call, I hope everyone would know what some of this stuff is going to be, but these are some typical acronyms that you might see running around social work, especially the medical side of things. And if you want to, you can just type in some of these in the Q&A section, but the VA has the ability to write contracts for veterans who need a few things. For example, a day program. Let's say a veteran and a caregiver need or want their veteran to have a little socialization, and they want them to go to a day program a couple days a week. The VA has the ability to write a contract to a few different places across the region for care. So the VA would cover a day program for that veteran. That is the same for certain veterans for short-term rehab. Home health aides. Again, I'm using the term there, CHA, for certified home health care, and for other respite services as well. So the VA has a big community role in providing health care to VA veterans in the VA. Did anybody guess all the, or some of the acronyms, Lori?
No, there were no guesses at all.
Nobody?
So are you gonna tell us what they all stand for?
No, unless you want to.
Yes, I'm gonna make you tell everyone what they stand.
No, go ahead. Look how far I'm already behind. I only have 15 more minutes. So moving forward, I was gonna move out to behavioral health. So, you know, the VA has two separate, very separate sections. You know, you have your medicine, and then you have your behavioral health. We reviewed all the majority of the medical side of social work. The next group we're going to cover is the behavioral health side. This is if anybody's from Syracuse, this is where the old DMV used to be, down on Erie Boulevard. It's across from Empower. Next slide. On the 7th floor of the hospital, however, we do have an inpatient psychiatric center. We have a 16-bed acute hospitalization unit used just like any other acute setting. A veteran would come to the emergency room. They would be medically stable, but they wouldn't be psychiatrically stable. The emergency room would get psychiatry involved, and the individual would be admitted if needed into the psych unit. There is no detox at the Syracuse VA, including the psych unit. If somebody needed detox, the Syracuse VA contracts that out to community providers. That we just have to make sure that they're medically stable for discharge. If they're not medically stable, then they would be admitted to a medicine team. Next slide, please. A couple of our outpatient clinics. Now here I did spell out each one of the acronyms because I didn't want to take the chance of me forgetting at the last second. We have a lot of clinics in behavioral health. Here's a few. So you have the PTSD clinic. Obviously, they are providing care to veterans who have post-traumatic stress diagnoses. It doesn't necessarily have to be war or combat related. It could be any post-traumatic stress incident. Substance abuse treatment. That's for individuals with, and we have a bunch of different substance abuse treatment programs too. We have an opioid program, which a managed program. We have OMH, which is for folks that just have mental health conditions that would need counseling services. Primary care mental health. Earlier, when I had mentioned the primary care teams, I had mentioned there was a psychology service on the teams. Those folks are on primary care as a bridge in order to get to behavioral health. So if a physician or social work or anyone identified a veteran who needed behavioral health, they could see their primary care mental health provider for, I believe, 6 visits up, and like I said, it's kind of a bridge until they get that initial appointment with behavioral health. And then the PRRC, that is for individuals with serious mental illness, and the goal there is to teach and train in day-to-day activities so a veteran could be more successful living on their own. So for example, say someone with schizophrenia who had trouble navigating the bus system in order to get groceries or make it to doctor's appointments, things along those lines. Next slide, please. some outreach programs, suicide prevention. If a provider, so the VA has a national hotline for suicidal individuals to call if they needed help, especially on weekends or overnight, or if someone just didn't know who to call. It's called the crisis hotline. And what happens when somebody calls that number, eventually it goes through the suicide prevention team here in Syracuse, and then we would provide outreach to that person. And then other ways that someone could be engaged in that program would be if a primary care provider identified them, if the primary care nurse identified them, or if someone coming out, perhaps the hospital, identified someone as being highly suicidal or even a low risk, they could still provide some service to an individual. The Veterans Justice Outreach, that is for incarcerated veterans that are in jail. The Veteran Outreach Coordinator would work with someone and try to identify any needs that they might have while they are incarcerated. We have a mental health intensive case management called MHICM, and that's intensive case management. It's kind of right there in the title, for folks that have serious mental illness, or just, again, they just need that little bit of help to try to get to doctor's appointments, or get groceries, or help with getting payees set up, those kind of things. And then we have HUD-VASH. It's a housing and urban development supportive housing program. What the VA does is they partner with HUD, and we're able to provide people, if they meet the eligibility criteria, with vouchers for housing. And we have a program that's pretty specialized, that group, of the criteria things, and the majority of social workers do referral, or at least in my experience, do referrals right to that program, because it's complex, and actually a lot of these programs are kind of complex, and you never really know how the criteria is kind of going to fit individual. And the social workers that work inside these programs have specialized knowledge sets, so they're good to talk to kind of individually. Next slide, please. So I think everybody's ready to kind of get back to normal a little bit here. I'm sure I'm not speaking just for myself, but the Syracuse VA was selected to perform what I referred to as a soft opening. I don't think that was technically the term, for our network. So the New York, New Jersey network. June 1st, we started this soft opening. We started scheduling appointments for 4 different clinics there. And the goal was to increase our openness and our appointments by 10% every week. So you can kind of see, unless we have a spike, within 10 weeks or so, hopefully we'd be able to just come right back into a normal healthcare environment here. So far we've been doing okay. Next slide, please. Then for the providers that are out in the community, I kind of wanted to review real quick, if you were out in the world as a civilian social worker or nurse or anything, and you identified somebody as a veteran, how would you, and if they asked, I always wondered how to get into the VA. I wanted to just provide a little bit of information on how you would engage somebody in that. Not everyone who identifies themselves as a veteran is eligible for VA care. So Congress puts out the rules every year and the eligibility, and there's basically a few ways for someone to verify if they're eligible for VA care, and that all goes through the Health Benefits Center. And during normal work environment, people just walk in and talk to a Health Benefits Center employee and they figure it out. However, under our current environment, you can do these three things. You can either call in. The Health Benefits Center will mail an individual an application. They would just fill it out and mail it back with a copy of their ID. They can walk in still. They can walk in. They wouldn't be able to come in, and the health benefits would give them the rundown and provide them with an application. Or if somebody came in via ambulance and came to the emergency room, care will be provided as needed, and we have people who check in on folks in the emergency room to verify they are eligible for care. So there's a few ways there. Next slide, please. The things that I thought that we learned from this whole experience was really how fast we could move, from working day by day like everything was, usual business, to within a week it seemed like, I would say 75%, it seems like, of the non-clinical staff were working from home. So they were teleworking. And then the telehealth visits and the virtual video conferences, I use both of those every day here. Even on the nursing home, I use those. Primary care uses them, and the specialty clinics use them every day. So it's quite amazing how quickly we could move on some of those things. Next slide. I wanted to give everybody kind of a couple resources. So these are VA resources and national resources. If you see the second one down there, the crisis line, that's the one I had mentioned before with the suicide prevention team. And then I also put on our CNY 211 site, just so we would, be able to review them again. And then the disaster distress hotline, and what kind of things that we might need during some of these times. And then that falls under the care of psychological needs just as much. The New York State Department of Health started a program for psychological care. Next slide. Okay. The Syracuse VA, I want to say, has about 70 social workers here. I want to say we're right in that area. Each team, each department, and then in some departments have more than one social worker. Everybody has access to one. They know how to get a hold of them. We have a phone number here that's just for social work triage that's checked every day, including the weekends. And I put that on there for you. If you were ever to meet someone, or if you had a general question that you didn't have a point of contact on and you just wanted to find something out, you could call this number here, the 6903 number there for social work triage. And it might take a day, but somebody's gonna get a hold of you and either answer your question for you or get you in the right direction. Next slide, please. The one thing that I just wanted to remind you is that, every person is different. Every veteran is different. Every situation is not the same. If you have any questions, just, specific to someone, or if they're just general, reach out to any social worker that you might know, or if you don't know one, you can always reach out to me. And like I had mentioned previously, we can't answer the question, we'll get you in the right direction. And that is the end of my slides. So if anybody has any general questions or comments, this would be a good time.
Yep, just one other thing. You had mentioned iPads. What about if a veteran needs other devices? Are there programs for that, like a cell phone or hearing aids or any those types of devices?
Not the cell phones. Cell phones, social worker we would go through any of the civilian type programs. Hearing aids, definitely. Every veteran's eligible to utilize our audiology department. That would be my quick answers for both of those. You remember the old like Assurance Wireless and things like that?
Yeah, okay.
That's what we would use for cell phones.
Okay. I don't see any other questions. We have just 3 minutes, so let's give it a minute.
Okay. And I don't think I put my email or anything on here. I should have. If anybody has anything they wanted to ask outside of the group, you can email or call or however you'd like.
And you are also willing to share your PowerPoint. So if anyone wants a copy of that, they can email me as well, and I'm happy to forward it. It's ldicaprio.lee@verahouse.org. And with that, I'm looking to see if someone's typing a question. Oh, we did get one more question. What is teleworking? Is that different from telehealth?
Telework is, if I were working from home, telehealth is me providing healthcare over the phone. So telework is like our business office that is working from home.
Okay. Okay. So I think that's it. And we are just about at time. So I want to thank you for your time and for that great information about VA services, some of the changes in services, and where you're moving forward to. And as always, thank you to Brianna, our ASL interpreter. And so I'm going to stop sharing the screen. And I am going to thank everyone for being a part of this and say goodbye. And I hope everyone has a good rest of their afternoon.
Thank you.
Bye.